Welcome to Chapter 3. In this chapter, we are going to learn about terms related to the whole body. The learning outcomes for this chapter are defined in your text, and again here, you're going to define the word parts related to body structures, to regions, and to cavities. You will also define terms related to body structures and regions, directions and positions, and colors. You'll learn to spell and to pronounce medical terms built with common combining forms that we've been talking about in the last few chapters, prefixes and suffixes related to the body as a whole, and describe common types of medical records used in the healthcare setting, and this will just be the beginning of that. You'll be able to explain what a body system is and why it's useful to learn medical terminology by body system, and I hope that you complete all chapter exercises and use some of the companion student resources on the point. This chapter builds on, it continues to build on word parts that we learned in chapter 1 and 2. The focus, though, now expands to include common terms used to refer to the body as a whole rather than specific body systems, and I'll talk a little bit about that later. And that's mainly what the rest of the text covers is body systems, but we really need to learn about body structures in health and disease as a whole. Body structures in health and disease, when we talk about that, we first have to talk about the healthy state, which is the body functions optimally without any signs of disease or abnormality, and we have to understand those terms. And in such a state, the body is referred to as it is in a homeostatic balance. But when an imbalance exists, diseases or disorders result. And this section introduces you to word parts related to body structures in health and disease. And as we go through this PowerPoint lecture, I'll read some of the combining forms and let you read the meaning, just so you can understand how the combining form or the medical term is pronounced. In this section, the combining for adeno, blasto, cyto, fibro, gluco or glyco, hemo or hemato, histo, hydro, leo, lipo, morpho, myo or myoso, necro, neuro, nucleo, osteo, patho, sarco, tropho, and visceral. These are word parts related to body structures in health and disease. Continuing this, when we look at suffixes related to body parts in health and disease, you're going to see site, oma, osis, pathy, plasia, and stasis. So those would be some of the common suffixes that you're going to see. In exercises 1 and 2 in the chapter, you can do some practice writing the meaning of the word part and matching word parts with its meaning. Here we've moved on to terms, and there's some pronunciation there and the meaning. So again, I'm just going to pronounce these terms so you're familiar with the pronunciation of terms related to body structures in health and disease. The first term, body system, cell, chromosome, cytoplasm, gene, nucleus, cytology, histology, homeostasis. We talked about that briefly, the state of equilibrium, metabolism, organ system, somatic, systemic, tissue, and visceral. Here's another table of terms from your book: acute, chronic, etiology, And I like this little section here where they talk about etiology, meaning the term etiology is sometimes used to refer to a specific cause of a disease. So it can be the study of the cause of the disease or reference to its cause. For example, you could say that the etiology of an infection is a certain bacteria. So continuing with these terms, the next term is exacerbation, hyperplasia, idiopathic, inflammation, lesion, necrosis, pathogen, and remission. You have to remember and really look at the levels of organization in the body. And to better understand the human body, it's been divided into different levels of organization, and we can see this figure here. Cells are the smallest independent units and compose the first level. Many similar cells together form tissues, and tissues make up an organ, and organs make up an organ system or a body system, and all the organ systems form the body as a whole. So each level is more complex than the last, and it's important to understand what each level is and how the levels are interrelated. In this section, exercises 3 and 4 help you practice writing the correct medical terms for the meanings and give you some sample sentences for you to interpret or to identify the appropriate meaning in the sentence. And now we're going to move on to body areas, cavities, and the abdominopelvic divisions. So to pinpoint areas with universal precision, we divide the human body in different ways. 3 commonly used ways to divide the body are body cavities, abdominopelvic regions, and abdominopelvic quadrants. And this helps us as practitioners to localize structures and enables healthcare workers to identify exact locations. So for example, if a person has a pain in the hypogastric region, it may be an indication of appendicitis, which is an inflammation of the appendix. A region is a portion of the body, and this section covers combining forms and terms related to body areas, cavities, and abdominopelvic divisions. So again, here's some combining forms related to body areas, cavities, and abdominopelvic divisions, and I'm just going to sound these out for you, and there's some practice exercises in the book. So the combining forms are abdomino, acro, brachio, cervico, lumbo, pedo or podo, pelvi, and thoraco. Some terms that you're going to see and need to become familiar with related to body areas is the abdomen or abdominal region, the cranium, the diaphragm, an extremity, the pelvis or pelvic region, and the thorax. And be sure to practice in your book the sample exercises. Additionally, we as healthcare professionals, or you as future healthcare professionals, will use medical terminology to refer to specific areas of the body and to identify these precise locations. So the tables in this PowerPoint and in your chapters introduce the terms used for different areas of the body, cavities within the body, and clinical divisions of the abdomen. Here, these terms are abdominal cavity, cranial cavity, pelvic cavity, spinal cavity, and the thoracic cavity. When we look at terms related to the abdominopelvic divisions, the terms that you need to become familiar with are the abdominopelvic regions, the epigastric region, the hypochondriac region, left and right, the hypogastric region, the iliac region, left and right, the lumbar region, left and right, the umbilical region, and the abdominopelvic quadrants. In this diagram, the different body cavities are shown in a lateral view, and here we can see all of those cavities we were just discussing: the cranial cavity, spinal cavity, thoracic cavity, diaphragm, the abdominal cavity, the pelvic cavity, and the abdominopelvic cavity. You can see it contains two different cavities. This picture is very important. We refer to these areas quite a bit, this slide and the next slide. This is the 9 abdominopelvic regions. So become familiar with those: the hypochondriac region, the left and right, the lumbar region, left and right, the iliac region, left and right. And we see the epigastric region, the umbilical region, and the hypogastric or suprapubic region. Again, this slide, very important. This diagram shows the abdominal pelvic region, and it's usually divided into 4 quadrants by 1 horizontal and 1 vertical line. So the right upper quadrant, RUQ, left upper quadrant, LUQ, right lower quadrant, RLQ, and the left lower quadrant, LLQ. The abdominal pelvic regions, you need to think of the abdominopelvic regions as a tic-tac-toe board with 2 horizontal lines and 2 vertical lines dividing the area into 9 regions. So this is the 9 region, and then this is the 4 quadrant region. So both very important. We use these very often in the medical record and when writing medical terminology. So practice writing the meanings of the terms and practice using the appropriate meaning in a sentence. Next section is the anatomic directions, positions, and planes. And when we're referring to a direction or a position on the body, it's important that we as healthcare professionals, or you as future healthcare professionals, use consistent terminology to ensure that the correct meaning is understood. And to that end, practitioners, we all use directional terms to indicate the relationship of one body part to another. So for example, superior means upward and inferior means downward. So the nose is superior to the chin. A plane is an imaginary flat surface used to divide the body or organs into distinct areas. Planes allow us to study and visualize the structure and arrangement of various organs, especially when we're viewing x-rays or CT scans. And so this section is going to introduce words, parts, and terminology used to visualize the body and talk about specific body locations. So what we're going to talk about first here is the combining forms and terms. So caudal, cephalo, dorsal, inferior, and medial. Here we're going to see some prefixes related to anatomic directions, divisions, and planes. So antero, circum, epi, infra, inter, intra, latero, peri, postero, proximo, retro, sub, super, supra, and ventro. Terms, cephalid, caudad, superior, inferior, anterior, posterior, ventral, dorsal, lateral, medial, unilateral, bilateral, proximal, distal, superficial, deep, and antero-posterior. I'm going to stop here and we'll move to the next section.